And let's go ahead and bring in our chief health editor, Dr. Partha Nandi. Dr. Nandi, many schools that started back in August, right, a week ago or so, saw cases skyrocket. And that makes me worry a little bit about what's to come. Do you expect we'll see another sharp rise in numbers now that schools are really in full swing?
I really find this extremely concerning, especially since children, as you noted, now make up 26.8% of weekly COVID-19 cases. That's more than a quarter of our cases nationwide. Now, the schools that really saw case numbers explode in August were mostly in the South. And here's the thing, right? Many of these schools did not require masks or have proper mitigation measures in place. So it's no surprise to me that tens of thousands of student teachers and school personnel ended up being quarantined. And it didn't take long for this to happen because the Delta variant is so very contagious, Amira, that some schools had to close a week after school started because of infections. And here's what physicians like myself and also health experts around the nation are really sounding the alarm. It's imperative that schools take action to stop the spread of the extremely contagious virus, or we're really going to see a lot more outbreaks in our schools.
Yeah, it seems like children are more vulnerable now than ever before. So what's key in your mind to lowering the risk of outbreaks?
So preventative measures, right, are only one part of the solution. So again, wearing masks, we talked about this, making sure buildings are properly ventilated and keeping at least 3 feet of physical distancing are just a few of the CDC's key mitigation or prevention measures. How effective are these? Really depend on two factors. One of them is the community transmission rate. So what that means is that the higher the case numbers in the surrounding community, the more risk it is for children to pick it up. And also the other factor is vaccination rates. The lower the vaccination rates in the community, the higher the cases for COVID. And there's data to back this up. A recent study looked at the number of kids, right, hospitalized in August. And here's what we found, that the numbers were 4 times higher in states with low vaccination rates. Extremely concerning. On top of that, another new study found that in July, right, adolescents, Amira, that were not vaccinated were hospitalized at a rate that was 10 times higher to adolescents that did get the shot. So this is really good news for COVID vaccines. As I said before, school prevention measures are one part of the solution. The other is, as we've talked about, getting vaccinated against COVID. Will these two preventative measures stop the virus 100%? No, but together they can really help to protect our kids and our community that the kids are living in, to greatly reduce the chance of getting seriously sick. And that's what it's all about.
Critical measures you laid out there. Dr. Nandi, as always, thank you for your time. And if you have a coronavirus question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter.